Today's video will be on schizophrenia. We'll choose a topic related to mental health since we are kind of in a tough time right now and it can give a lot of stress to mind. And I choose schizophrenia is because I found that there are many people having misconception to it. And I decided to talk about it to clear out the context. So schizophrenia affects 20 million people worldwide. And the definition of schizophrenia was fragment pattern of thinking. Schizo means split and mind. So it basically means splits of mind. But it doesn't mean like multiple personality. And that's one of the misconceptions due to media kind of spreading news. So psyche is characteristic by distortion in thinking, perception, emotion, language, sense of self, and behavior. So it's a serious mental disorder which people can kind of interpret reality abnormally. And it's a syndrome, so it means that it was characterized by several types of symptoms. So here are some key facts that lead to my research and the idea of making this video. Schizophrenia is associated with considerable disability and may affect education and occupational performance. And most people with schizophrenia are not as dangerous as violence as media describe. They are actually not more dangerous than you and me. Since high rate of co-occurring medical conditions such as like heart disease and diabetes, people with schizophrenia are 2 to 3 times more likely to die younger. And facilitation of assisted living, support housing, and support employment are effective management strategies for people with schizophrenia, which most people think that is untreatable. We will get into that later in detail. So discrimination and stereotype, even violation of human rights for people with schizophrenia is really common. And also some people think that schizophrenia only occurs in people like adults who experience bad things in childhood, but actually it's also diagnosed in children. So now we get to symptoms. This is a picture I take from one of my citing sources because it explains it really detailed way. And symptoms. So before I get into symptoms, I need to clarify that different people may experience different symptoms. And there are 3 kinds of symptoms: positive symptoms, negative symptoms, and disorganized symptoms. Or we can call it cognitive symptoms. So positive symptoms is abnormal present, like hallucination, which is like you are hearing voice or seeing things that do not exist, or paranoia, it was like exaggerate or disorder perception, belief, and behavior. Negative symptoms is decrease in physical and mental ability. Decrease in ability, like, planning, speaking, expressing emotion, finding pleasure. And disorganized symptoms are like really difficult to notice. For example, people may be confused and disorganized thinking and speech, or have bizarre behavior, abnormal movement, worsen memory or cognitive function. So this is just a fundamental description, kind of like an overview video. So we will not describe the symptoms in great detail. So people with schizophrenia seems to cycle through 3 phases, typically in order. The first one was called prodroma, which is like people kind of become withdrawal. They start spending most time alone. And this phrase is commonly seen in kind of other mental illness, very normal. And the second one was active, where more severe symptoms occur, such as delusion, hallucination, disorganized speech, disorganized behavior, and catatonic behaviors. The last phrase is residual, which is all the cognitive symptoms happen. So, in order to be diagnosed as schizophrenia, according to DSM-5 to SCD-10, it was like two famous books that published online. You can check if you are interested. You must have at least one of delusion, hallucination, disorganized speech, disorganized or catatonic behaviors. And it must be going on at least 6 months. And within this 6 months, you must include 1 month of active free symptoms. Oh yeah, you also need to have negative symptoms. So those symptoms cannot be due to other conditions like substance abuse. For it just mess with your mind. It must be called schizophrenia in order to have schizophrenia. In addition, cognitive symptoms not need for diagnosis. Research has not identified one single factor yet, but there are many guesses, such as genetic. So they do not find genes that conclusively link to schizophrenia yet. But they find one parent with it, offspring have 13% chance having it. If both of his parents having it, then the percent rise to 15%. And also there are environmental factors like early or prenatal infection or autoimmune disorders. So if you are born in a very bad environment with abuse, violence, you are more likely getting schizophrenia than you are in a warm, loving places. Oh. Third, it may be increased in dopamine level. Due to the clue of antipsychotic medication help treat schizophrenia by blocking dopamine receptor D2. However, it doesn't work the same for everyone. So it was still only a guess. Now let's go to the next slide, which is epidemiology. So 0.26% of men and 0.25% of women getting schizophrenia. So the percentage is about the same, but men was a little bit higher, just by 1%. And men typically getting it one set at the mid of 20s. For women, the one set was at late 20s. And for reason unknown, it was less severe in women. So people guess it may due to regulation of dopamine. And we have a graph here. And here comes the point that I want to emphasize. Schizophrenia is treatable. Most people think that there's no treatment for it, but there is treatment. It's just there's no direct cure. And with treatment, most symptoms of schizophrenia will greatly improve, and the likelihood of recurrence can be diminished. And according to research, there are more than 69% of people with schizophrenia not receive appropriate care. So the possible treatment, at least 3 here: training primary healthcare personnel, supporting families in providing healthcare, enhancing independent skill like life skills training, social skill training through recovery-oriented psychological intervention. And if you want to know more, you can check out my sources. And there are some more listed there. Sometimes your doctor may not prescribe you medicine. It's because antipsychotic can effectively reduce symptoms, but it comes with additional consideration like cost, side effects. So doctors think twice before offer those medicines. And this is my beautiful works cited.